Now we're quickly trying to look at the next bone disease condition that we're looking at, the x-rays. That's how the x-rays will look like. And this is what is known as the Paget's disease, a very popular disease, right? Okay. So for Paget's disease, how the x-rays look like, or how can you be able to describe the x-rays if given to you, like in an exam setting, you know? So Paget's disease that's basically what? Of the bone. I think we have the one of the breast, right? Okay, so this could be of the bone, okay? So you should know that it's also still called what? Osteitis deformans. So it produces very characteristic changes on the plain x-rays of a normal bone, showing you some abnormal bone remodeling. Okay, so what are the x-ray features? So in early lytic phase, you see what? Osteolysis. So you see areas of bone destruction with what? Radiolucencies. Okay, shows you that it's losing its thickness. So you see what is known as a blade of grass or a flame-shaped appearance in long bones. Then in the skull, you see the osteoporosis circumscripta, well-defined radiolucent patches in the skull valves. Can you see them? Okay, circumscripta. So mixed phase, you see combination of radiolucent and radio-opaque areas. You know, bone looks irregular and mottled. Alright, late you see all those sclerotic phase where there's now diffuse sclerosis, you know, cortical thickenings, bone enlargement and deformities, which is now bowing of the femur of the tibia. That's a sabashing deformity. Then skull, there's now cotton wool appearance due to patchy sclerosis. Then the pelvis, there's now coarse trabeculae pattern, okay, and also bone expansion. Okay, so this is a pelvis. You can pause to observe the pelvis. So what we have here, most frequent sites, you're having all those, you know, in the pelvis, in the skull, you know, femur and tibia, you know, spine. Clinical importance is it can cause a lot of pain, deformities and fractures, you know. So it's always good for x-ray so that I can be able to diagnose the disease condition.